The COVID-19 pandemic forced schools to change to distance learning methods to minimize contact between families and faculty. United Independent School District faced the challenge successfully, going so far as to provide free internet to disadvantaged families and those living in outlying areas by converting school buses into mobile Wi-Fi hotspots. However, one problem remained: state testing, which students could not take at home. The state required students to take their STAR and TELPUS tests in person and on campus.
It's one of the requirements for graduation, so they have to go ahead and present 5 tests, which is the STAR EOC, the end of course assessment, and those have to be physically taken face-to-face here on our campus. Here at the 9th grade campus, we do take our biology, algebra, and our English 1 as well. So this semester we are having our students come here to our campus to go ahead and take our test. We do have our students that have sometimes special accommodations, so we do have them test here on our campus online, depending what special population group they belong to. Then we do have our students also taking the traditional, which is of course paper and pencil as well.
What the state sent out back in November was that for right now, for a student to count with their end-of-course exams, they would have to be present at a campus where a live monitor is there. Where they test paper pencil, or it's an online testing, it has to be, for right now, it's at the campus. And as of right now, the state has not lifted those restrictions as far as the requirements for end-of-course or STAR. For right now, every student for graduation, they must pass the 5 end-of-course exams.
Using guidance from the Centers for Disease Control and the Texas Education Agency, the district and its schools came up with procedures and protocols to move students in and out of campuses to take their state-mandated exams safely and efficiently.
Let me tell you that we've had meetings. Our meetings have started since about 2 months ago, and we've been meeting regularly with testing coordinators and with principals at the campuses to make sure that all the security measures for the STAR testing are in place. That we have not dropped. That is something that we must follow. So they're training with their manuals, the security storage of the material, the handling of the material. We've scanned everything, so everything is organized, led by the Student Assessment Department from Director Cristina Casanova. And so we've made sure that the integrity of testing is kept.
My department has worked closely with transportation, with support services, with the superintendent's office, as well as our high school department in order to ensure safety. The priority, of course, is faculty, staff, and of course, student safety. So we've been in close contact with making sure that everything is sanitized, making sure that the students are ready, that temperature checks are done. So we've been planning this for the last 2 months.
Right now, because of the pandemic, it is extremely important that we take the safety precaution that every campus has. And right now, our main goal is the teachers and, of course, the student safety. 6 feet apart, make sure that there's 8 to 10 kids in the classroom, masks on all the time, and when they are given breakfast or lunch, they are separated also, and of course, also with the buses, making sure that when the children come in, that they are taking their temperature and that everything is secure. I have worked very close with the bus transportation and food service to make sure that everything is safe and students feel comfortable and they can take their tests, because it's very important. This is for graduation.
We have created smaller testing classrooms for our students. As per TEA guidelines, we should be having anywhere from 10 to 12 students in each classroom, but here at Johnson High School, we are only having 8 to 10, maximum 10, and of course 10 students in our larger testing classrooms. But most of our class sizes run up to 8 students maximum. We are providing students individual Ziploc baggies where they're allowing to keep their materials, even their headphones. Students who are testing on computer and require headphones, we went ahead and we're providing disposable headphones for the students. So we're trying to limit the contact between the student and the teacher.
All measures are being used for the safety of all our students. Obviously, all students cannot go in unless they're wearing their face masks. Same thing with our employees. We have a lot of students that have been going in not only with their face masks, but also with their shields. And In the classroom themselves, we have set up where they have the little plexiglass set up in every single testing environment. Every single classroom has them for all the students that are being tested.
The 4 high school 9th grade campuses ran into a unique problem. Their students had never set foot in their campus and couldn't possibly know their way around.
I guess harder for us these 2 days because a lot of these students hadn't come in for testing. They didn't do benchmark for English. We did it for bio and algebra. So those kids know where to go, where the school is, because for some of these students, they don't know. You know, they haven't even been to the school. So everything's new. So they walk in and they're like, oh, what do we do? Or where do we go? So they didn't know where the cafeteria was. So we're kind of like telling them exactly, doing the Dr. Owl, checking their temperatures, and then guiding them to where they need to.
Of course, school nurses were fulfilling their vital role of guarding the health of students and staff alike using their expertise and training, as well as modern technology in the form of an app for students.
One of the things that we're doing with the students is we're doing some questions that they need to answer before coming into their classrooms. One of the resources that we have is Dr. Owl. We have QR codes that are posted outside of the school, and so the kids are able to access Dr. Owl with their phone. If they don't have a phone, we have the computer here, and we have another computer set up so the kids can come and we can log in their information. Some of the questions that Dr. Owl asks first, if they're a student, a visitor, or staff member, because even the staff are doing this Dr. Owl application. So when the students come in, we log in their information, and they're asked, have they had COVID in the last 14 days? So they either answer yes or no. The second question, have they had anyone close to them that's close contact that has been diagnosed with COVID in the last 14 days? The next question, the third and final question is, do they have any symptoms? And they list all the symptoms.
Actually, parents are calling us and asking us questions, and we're giving them information that, you know, students need to make sure they come in with masks on. They make sure that they wash their hands when they're supposed to, that they use hand sanitizer the way they're supposed to. Anytime they touch any sources that they think might be contaminated, they should be using hand sanitizer. We're asking parents also that if they have any questions or concerns, to make sure that they call the nurses before sending the student to school. In questions as like, my son is sick, or because there's somebody in the family that's sick, or they have tested. And this is vital information for the nurse to know, so that we can, you know, let them know how to further proceed the situation.
All in all, the district proved that students and faculty are just as safe going to school as they are going shopping at the grocery store or picking up food at a restaurant, and perhaps more so for all the safety protocols and procedures.
We're following all CDC guidelines. We're having the students social distance, hand sanitizer when they're coming to the building. As they come into the building, we're asking them a series of questions, whether they've been in contact with someone who has COVID, whether they themselves have been diagnosed with COVID, whether they have some symptoms. Once they say no to all the questions, we do a temperature check, hand sanitizer, and we send them to either the cafeteria if they're going to eat. Those are people who are not going to eat and do not want to remove their mask. We send them to the small gym or to our band hall. And we hold them there until it's almost ready for them to go test. Once they go test, again, we bring them all out, social distance, 6 feet apart. And we're doing our very, very best trying to keep everybody safe.
I think it is a very safe environment. It is a very safe environment for the faculty, the teachers, and the students. I give a lot of credit to the teachers and the faculty and the administrators and everybody. We work together to keep the parent at ease. Whenever the parents they have a concern, so they want to go ahead and know what we're doing, everybody's informed that we are safe here on campus. We are safe here on campus, and the safety of their children is a priority, and the safety of the other people that are coming to work as well.
It's okay to send them, because I know that we're making sure that face masks are mandatory. I know I'm not wearing one right now, but I'm socially distanced enough. that where hand sanitizers is provided in all the classrooms, that we have the signage throughout the building that says, stay away, mind your social distancing and so on and so forth. So we're also cleaning and sanitizing the building every day. We're using industrial strength sanitizers to make sure we vape the rooms. The rooms are being vaped after school, so that in case a child does come in who doesn't know that they're positive and they touch a computer, we don't have somebody else touching it the following day where they can get the virus through that means. We're communicating constantly with our kids in both languages so that they know that this is serious and they need to take this serious. So I would tell the parents that, err on the side of caution, but if you want to send your kid, this is a safe place for them to be.
I'd like to assure our parents at UISD that UISD has taken every measure following CDC guidelines to making sure that their child is safe in a safe, nurturing environment. We're not going to hinder their safety at all. We're going to make sure that we're going to go out of our way to provide for them an education where the parents can be proud to send their children to school.
For United Independent School District, I'm Jose Sanchez.